It is 6 o'clock, so we shall start the meeting. So welcome to the Adult Health and Social Care Scrutiny Board on this Thursday evening on the 19th of November 2020. I'd like to welcome anyone who's listening on the Council's YouTube channel. You're most welcome to listen and ask any questions as well, I think, through the chat. Welcome to everyone who's joined us so far. So let's go through the agenda. So substitutes nominated for this meeting, I have Councillor Anne Collins for Councillor Mohammed Naeem. I don't think we've got any more substitutes, is that right, Carol? No, that's fine. No apologies as well. Okay.
Just apologies from Councillor Naeem.
Yeah, no worries. Yeah, no, superb. Okay. Item number 2, members' interest, to remind members to declare their interest at the relevant time. Item number 3, admissions to the public. They are welcome to join us for the whole session on the live stream, as we suggested. This evening we'll be raising hands. So just to remind people, if you click on participants at the bottom of the screen, it will come up with a list on the right-hand side, and then there should be a raise hand facility. So we'll get through all the meeting as swiftly as we possibly can. And by the way, if I take you in a different order, my apologies. We do try to be observant, but sometimes it's quite challenging. So item number 4, minutes of the Adult Health and Social Care Scrutiny Board held on the 29th of October 2020. Can I take those as a true record? Can I? Yeah, fantastic. Councillor Hutchinson and somebody else to second. Yeah, Councillor Stephanie Clark. That's perfect. And all in favour, of course. Okay, superb. So we're going to the item number 5, which is the COVID briefing for the evening. So Karen, do you want to? Karen Walker, welcome to the meeting. You're here on behalf of Debs Harkins, so very much welcome to the scrutiny board. And perhaps you'd like to give us an indication of the current position.
Yeah, I can do that for you. Thank you very much. Welcome, everybody. I think where I would start really is that we've reached a critical point in the COVID pandemic. What we've seen in Calderdale, we've seen rates of infection increase in recent weeks. Currently, Calderdale's ranked as 20th in England. That's not in a good way, but in a bad way. Our current rates are at the highest they've ever been. I don't know how much figures you want, Chair, but you know, I can give you the overview, and if anybody wants any particular figures, I can give that. I don't mind. Yeah,
I think an overview at this stage will be really welcome, just to give members the current situation and where we're going to, really.
Yeah, that's fine. So yeah, we're at the highest rate we've ever been. Our positivity rate is high, which is the ratio between all the people that have been tested and how many of them are positive. We're higher in Yorkshire and Humber and England for both the rates and the positivity rates. I think what we're seeing at the moment in Calderdale, it's highest amongst the 30 to 44 age group, and lowest is still in the 0 to 15-year-olds, although we've seen that increase slightly in the last few days. I think, unfortunately, we do expect that this will continue to rise in the coming days. I know we're 2 weeks into the lockdown, but it's still going to rise, we believe. We've seen large numbers of increases in the number of people in the hospital with COVID-19. Many of those are under 60, and that's putting significant pressure on the NHS locally at the moment. In terms of excess deaths, we since March, 20th of March, we've had 191 excess deaths, of which over 82% of those were COVID related. The week ending the 6th of November, which is kind of the most recent data we have, we had 11 excess deaths, which were all COVID, most very sadly. We've had a number of care home outbreaks and some in schools. And I think at the moment, our key messages are really quite clear. There's 3 things. That we need to limit contact to the absolute minimum, and people need to work from home if they can possibly do so. And that people wear a face covering if we have to go anywhere indoors that's not with our household, whether that be supermarkets or anywhere else, and basically stay at home. So that's really the messages that we're giving at the moment, and that's going to be really picked up with our comms team, and that's the messages that we're going to be getting out. In terms of testing and vaccination, because I'm sure you want to know about those things as well, we're still testing about 1,000 people every day. We are planning to roll out the mass testing using the new rapid flow tests. But what we are doing is learning lessons from other areas. And we're going to start with people whose jobs or circumstances put them at higher risk of being exposed to COVID, rather than blanket. And we've learned that from the other areas. And I think that's a feeling right across West Yorkshire. And those that wouldn't be eligible for a test under the current system. So, for example, we might do things around schools, taxi drivers, those sort of things. We're currently working with local organisations to work out how we roll that new testing out, but we're hoping to be starting that in December. And then in terms of the COVID vaccination, there's been a lot on the news about COVID vaccination at the moment. We've got a programme that's been established. Neil Smurthmate from the clinical commissioning group, he's the senior reporting officer, and we're working to the plan of starting in December, that we're going to get the vaccines in December. There's a couple of phases. Phase 1, which is the one that's immediately before Christmas, and that will be targeted at frontline health and social care staff, residents in care homes, and those people in our community that's over the age of 80. And our colleagues in primary care are likely to be doing a lot of that from the primary care networks. They've all agreed that they're going to pick that up. Phase 2 is in the new year, and that's going to be the wider rollout, which will be mostly in age bands, so working down from the older age bands to the younger age bands. And there's a number of work streams that have already been put in place. And one of the ones that I've really pushed for is around engagement and working with local communities, because that seems to be a bit of a gap at the regional level. We will, when we get to phase 2, need quite a wide range of staff to deliver the vaccinations. The vaccinations are in 2 doses. And given that staff are still working on delivering flu vaccines, it's quite an ask, really. A number of challenges around capacity. And I think that's probably the main thing around how we actually deliver that. But there is a number of work streams. So I'll leave it there, Chair, and answer any questions that
thank you very much. Yeah, no, thanks for the updates. I've got 5 marks so far. So if we can start off with Councillor Megan Swift there, please. You're on silent, Megan. You're still on silent. Do you want me to come back to you? Councillor Megan Swift, you're still on silent. Would you take your silent button off, please? I'm going to go to the next one. Councillor Stephen Lee at this stage, and then I'll come back to you, Councillor Megan Swift.
Thank you, Chair. I'm very sorry. I was trying to attract your attention by other means. I'm afraid I wanted more information than we got this evening. I realised the question was asked, and the general sort of, sort of approximations were deemed okay. But I would have liked the actual numbers, I'm afraid. I'm not being rude to Mrs. Walker, I hope not. I was trying to just stop her in full flow because the numbers are very important to me. There's a number of numbers that I've been monitoring throughout this. And I just we can't go back, Howard, but
No. I'm sure. Actually, Councillor Lee, I'm sure we'll be able to provide the numbers. I'm sure Karen will be able to.
I can give you the numbers now if you want them. I don't have a problem with that. Yeah. Do you want me to do that now, Chair?
Yes, please. If you don't mind, that'd be great help. Yes, please. Yeah.
It's not that I haven't got them. I just
no.
Yeah. Well, basically, our current rate up to the 14th of November, our 7-day rolling average was 494 cases per 100,000, which is the highest it's ever been. That's 45% higher than England and 9% higher than Yorkshire and Humber. Our current positivity rate is 16.7, which is higher than Yorkshire and Humber, which is 14%, and England is 10%. I did say that the highest amongst was the 30 to 44-year-olds. That rate currently is 754 per 100,000. And that compares with 0 to 15, which is 242 per 100,000.
Okay, does that help Councillor Stephen Lee?
It does, thank you, Chair. There's just one point I want to make. I've been monitoring the positive rate. You've just heard it now, 16.7%. And I think it was 14% in Yorkshire and Humber and 10% in the UK generally.
No, it was higher. It was 14% higher.
Yeah. We were 14%
worse
than them. Right, okay. The fact is, 16.7% positive infection rate has gone up steadily in the last several weeks, from about 11 to 13 to 15 to 16.7. And I find that very worrying. That's what the reason we're in this top 20. We've talked about this before. Something's going on here, which isn't happening so much elsewhere. It's very worrying. And I'm sorry, Chair, that's why I wanted the number. And 16.7% I find alarming. Thank you.
Yeah, no, thank you. Councillor Megan Swift, do you want to come back in now? Now you've got off mute.
Thank you very much, Chair. Firstly, can I declare an interest because I'm on the Board of Governors at the hospital? It's easier to do it now than wait till something crops up. And the other is a question for Karen, if that's all right. I believe we're one of the areas in West Yorkshire that they're being, I suppose, government are talking about doing a mass testing like they did in Huddersfield. I have a concern with that, and I have said it to others. Watching the queues in Liverpool, nobody social distancing. They might have been clear then, but they were probably with more people while they were waiting to be tested than they have been for weeks and weeks. My other question is the age group 30 to 44. Does that come from parents who have kids at school who are going to the school to take them and pick them up? Because somebody told me the numbers were slightly better at half term, but I don't know. Thank you. Sorry, Chair.
No worries. Would you like to come back on that, Karen?
Yeah, on your first question there, Councillor Swift, about doing mass testing. The new tests that we're going to start receiving, these new rapid flow tests, you might have heard them called lateral flow tests. They're the ones that are kind of associated with mass testing. So yes, we will be getting them. But what we're finding is, certainly from the experience of coming out of what happened in Liverpool, it was almost like a lot of they weren't getting to the right people. It was almost, you probably heard the term worried well. Yeah. And it was very much the worried well that were coming out to be tested, and the people that really needed to be tested weren't coming out for a whole range of reasons. So that's why we're saying, rather than just say roll up and we'll give you your mass testing, that we're actually being quite specific around making sure that we're getting to the people that we think we need to get to. And kind of going back to Councillor Lee's question, you know, we are doing a lot of testing, and it's not entirely the case, but the more testing you do, the more positivity you're going to find in the community. So we could say, on the other hand, we're actually doing a good job of targeting the right people. So, you know, that's the other side of that coin. But yeah, it is really worrying, but there are high rates in other areas as well. In terms of Councillor Swift's second question around, do we know whether it's families with children? It's hard to know that, I'm afraid, Councillor Swift. We don't get that level of detail. You could make those assumptions, but we don't have any. We don't have the evidence to say one way or another, I'm afraid.
Okay, thank you.
Okay, thanks for that. Could I bring in Councillor Hutchinson at this stage, please?
Thank you, Chair. I was wondering, in terms of closure of bubbles in schools, how Calderdale is faring compared to other boroughs in the north, whether we're having more bubbles collapsing than elsewhere, or are we having about the same? And I also wondered, with the lateral flow tests, the results, I think, take about an hour to come back. Are people being expected to wait until the results come back? I'm really interested in whether the results from these tests are going to be fed into the national test and trace system, so that the people who've tested positive are subject to the same contact tracing process as is going on with the standard swab tests.
Chair, do you want me to, can I come back to
Yeah,
that?
if you come back on that, yes, please, Karen, thank you.
I'll answer Councillor Hutchinson's second question first, if that's possible. In relation to the lateral flow test, we're actually in discussions for that very point, because otherwise, if we can't link it up, people can't get support from the national support payments to stay at home and isolate. So we've been arguing quite strongly that it needs to link up with the test and trace and our local contact tracing system, which you know more than most that actually we're doing really well locally in getting in touch with people. So we're in discussions about that, because otherwise it begs the question, why are we doing this testing if we can't support people? Would be my view. In terms of the schools, I'm not really at the front line on the schools because I'm dealing more with all the care home side, but I'm not aware that we're kind of an outlier compared to the rest of West Yorkshire. What I would rather say, I'll check with my colleague and get back to you on that particular question, because I can't say with any authority how that compares.
No, thank you for that. I've got Councillor Barnes, Councillor Greenwood, and Councillor Collins indicating to speak. So, Councillor Barnes, could you indicate, please? Thank you.
Thank you, Chair. I think I'm going to go back a step and echo in part Councillor Lee and Councillor Swift's concerns about the increase in figures. And I think what is worrying is the fact that we're now 2 weeks into lockdown. We were in tier 2 with relatively stringent measures before, and the trend just seems to be going up and up and up. Do we have any evidence at all as to where the transmission is occurring? Where is it actually physically happening? Because if we're all locked down, there should be very little evidence of transmission. So do we have any data at all as to where that transmission is happening?
And Karen Jones, come back on that, please.
Yeah. The evidence that we have at the moment, Councillor Barnes, is it's still the majority is household transmission or between relatives. It's not big workplaces or things like that. We might have one or two. There is some in care homes, but the majority it's to do with household transmission, and that's why we're really focusing on saying to people, the lockdown means lockdown. I think most people, if you look around at the moment, it's not as quiet as it was in the first lockdown. We're still seeing a lot of traffic, still seeing a lot of people out. For whatever reasons, people's tolerance around staying at home and going out in a minimum sense, I think has not happened this time round in this lockdown. That would be my assessment, that whilst it's a lockdown, people have seen it as a kind of semi-lockdown. So that's why we're focusing those messages on stay at home, do not go out.
Thanks for that. Can I bring in Councillor Greenwood, please, at this stage?
Yes, thank you, Chair. Councillor Barnes brought my question in there about transmission. And whilst we're asking people to stay in their homes, I think it was hinted at before that the group now, the 30 to 44, the people that are going outside the homes, of course, are the students. And they're still at school, and then they're going back into the home. Is it the fact that we've got people back to school that's causing this increase? Should we have a look at that again? So whoever stay at home, it's still spreading somewhere. My second question as well for Karen is talking about the vaccine. It's going to be rolled out in age groups, but will there be some provision to offer the vaccine to people with existing chronic illnesses?
Okay.
Yeah.
I'll go backwards again, Marilyn, if that's all right. In terms of the vaccine, yes, you'll know from the flu vaccinations that people in high risk are prioritised, and the same will happen with the vaccine. And that's precisely why the first phase is going to be people over the age of 80 and residents in care homes and staff who care for people, whether it be in the NHS or in care homes. So yeah, the schedule that's been drafted nationally is very much about protecting vulnerable people. That's their first kind of line of defence, rather than reducing transmission. Yes, it will reduce transmission as well, but it's primarily about protecting those vulnerable people. So that's kind of the whole focus of the vaccine and the schedule and the programme around that. In terms of children going to school, I think we don't have that information. We know about where bubbles have been sent home from school to self-isolate. I think it's a difficult one. You know, we took a decision nationally that schools remain open, and I think that was the right decision. But because of that, the rest of us need to be doing more, I think, is the bottom line. And I'm not convinced that people are self-isolating in the way that we need people to do. And it's difficult, it's really difficult for people. But that's where we're at the moment.
Okay, I've got Councillor, thank you, Karen. I've got Councillor Collins and Councillor Hutchinson, then we'll move on to bring in Sean Cook into the equation. So Councillor Collins, please.
Yeah, thanks very much, Chair. It's really a follow on from things that have been raised already. So we know now that the numbers are going up, which is a real worry, as Councillor Lee said. We know the age groups that it's most prevalent amongst. We know that it's household transmission, by and large, that is causing it. And we also have the feeling that the lockdown is not being taken quite as seriously as it was first time round. But can I ask, Karen, is it spread across all the wards? Because in the first instances, under the early figures we were given, it seemed to be more prevalent in certain kinds of wards, whereas the stuff that I've been reading from the Calderdale figures seem to suggest it's across the borough. It's not that you could say it's here rather than there. Can you confirm that for us, please?
Yes, Councillor Collins, it has been right across the board in areas where you wouldn't normally expect even. But we are seeing slightly disproportionate in some more disadvantaged areas, but it is right across the borough.
Okay, thank you. Councillor Hutchinson, please.
Thank you, Chair. Of course, saying it's household spread begs the question of how it actually gets into the household in the first place. And certainly if we have, you know, because so many more children have to live with their parents until a ripe old age, we do have many families where there's 5, 6, 7 people living within the same household. So one person becoming infected will lead to, is likely to lead to many more becoming infected. So I think we ought to be concentrating on how it actually gets into those households in the first place. But my other point was, there's a much greater appreciation of how this is an airborne virus. Airborne spread is the principal thing, and it isn't just droplets. So social distancing will not get rid of the risk if people are spending a long time in rooms without fresh air getting into them. And that message doesn't seem to be going out very loudly. I know that to individuals in homes, it may, that may not matter too much, but in schools, schoolrooms, colleges, offices, other places, I would like to know whether we are actually hammering home the point that people need to wrap up warm and keep the windows open for as much as possible and not spend too much time in the same room. Is that something that we will be taking forward with any kind of vigour?
And George, come back on that, yeah. So,
yeah, Councillor Hutchinson, I think that's all part and parcel of the advice that we're giving out all the time. I think at the moment we want to just focus on the three main messages, but in all our support to whether it's care homes, schools, individuals, workplaces, the issue of social distancing and well ventilation has been quite a priority for us all.
Thank you, Ken. Can you or one of your team send out what the arrangements are going to be in relation to the vaccine to members at some stage? So not necessarily now, but just when you've got the details to what's going to happen and when. I think that will be useful for members to pick up on. I think on that one, if that's okay.
Yeah. That's absolutely fine, because we don't know the detail yet. Yeah.
Exactly. I'm going to bring Sean Cook. Sean Cook is here on behalf of Ian Bain. So Sean Cook, welcome to the adults meeting. Would you perhaps like to give a perspective in terms of the care homes and the preparation for this winter period, please?
Yes, thank you, Chair. I'll cover activity around the hospital, the care homes as requested, and the designated homes, and also just in terms of the shielding element as well, which has been updated since the last scrutiny review meeting. As far as the hospital is concerned, probably everyone is aware that there is a very high level of demand, both in terms of obviously people coming into the hospital and being admitted, as well as presenting to A&E. So there is a whole system gold call every week, as well as silver calls every day, with all system leads to try and mitigate the amount of flow of the demand into the hospital and the management of beds in the hospital and the discharge of patients from the hospital. From the last couple of days, the numbers of people or patients that were COVID positive was at 117. I haven't got the figures for today. Hopefully that's decreased, and that has come down from figures from last week that were around 140 odd, 44. In terms of the work that social care have been doing with health colleagues across the system, both in primary care and in the acute setting, we are ensuring that as much as possible, the people being discharged from hospital, patients being discharged, are being discharged safely. A number are going into transitional placements before they go back to their home of origin, so that we can make sure that they're fully assessed rather than being in the hospital, because often that isn't good for them, as well as the demand that we need to manage collectively in that setting. And that has actually helped in terms of really collaborative working, good practice, particularly with therapists, social workers, physiotherapists and other clinicians in these transitional settings. And this year we planned as well to make sure that as far as the capacity that we needed, both in terms of are reablement, where there is still work to be done, and development in respect of capacity and rapid response. That is being expanded, as well as packages of care for people in the home. The transition, in effect, we're calling discharge to assess placements that are in given homes across the borough. EMI placements, elderly, mentally infirm placements, that we have capacity generally to support people to go into the right settings, and then preferably back home. What's really interesting as well is that more people are wishing, quite understandably, to be supported at home, which has put more pressure and cost on the system. But in terms of you know, the way that we've been going in terms of a directorate to ensure that more people can be supported at home, that's been encouraging. We've also got designated places. They are CQC designated homes, whereby people who have tested positive who are leaving the hospital can be supported to go into those homes for their period of isolation of 4. At the moment, that's the retreat in Greetland that continued from the first wave, and we've extended, or the CCG have extended, the number of places there to 12, as well as another home that we're working with, Valley View, that has a unit called Cartram Place. Again, that's a residential unit, and that's for 6 more people. There is also the possibility of expanding some of the transitional placements that they can have at the retreat for people who are coming out of their self-isolation that may need more transitional support before they go home. So we've got quite a comprehensive offer right across the piece, and we're looking potentially at more designated homes as the winter develops, in the event that we get a greater spike. As far as the homes themselves are concerned, there's active dialogue every day as far as contact with our contracts team and the homes themselves to pick up on issues. And we've stepped up our tactical command group, which is a group of system leads, including myself, to look at all of the issues in terms of preventing the likelihood of outbreaks, as well as reacting to those outbreaks when they take place. You may recall, be aware that probably about 6 weeks ago, we had a real spike, a significant spike of homes, 4 in particular, that had a high number of COVID positive residents and staff. We stepped the tactical command up to work with those homes and the other homes as well, and to learn from what had happened, so we can put the measures that we understood that we needed to make into the other homes as a preventative measure. And since then, the numbers of positive cases, both for staff and residents, have decreased. They were, in terms of residents, apologies, they were over 70 at one point across a small group of homes. That's now reduced down to 22, mainly because people have come out of their self-isolation. And similarly with staff, there were around 70 that had been tested positive. They have now gone down to 39, mainly because of a whole raft of measures, particularly IPC, infection prevention control measures, that have been put in place, as well as wraparound measures from primary care colleagues and social care to make sure that the homes had everything they needed in terms of sadly, but thankfully as well, in terms of the numbers of deaths that we had in the first wave, which totaled 35, since this second wave, and thankfully it's not been as great. And I think that's because of the level of expertise, the early warning in terms of the presentations, the symptoms that residents have been showing. Clinicians, as well as other professionals, have been identifying when people are positive, how they can be supported. So not as many people, thankfully, have needed to go into hospital. They've been supported within the homes, and we've only had 3 deaths since this second spike. As far as testing is concerned, that's very regular, both for staff and residents, on a weekly basis for staff, fortnightly for residents. And that is now over 9,500 tests cumulatively. In terms of PPE, that's nearing 2.5 million pieces of PPE that are regularly, and we've got good stocks for over the winter now that are being given to the homes. And also just finally, in terms of the shielding, we've changed the arrangements this time around. Again, if you recall, with the first wave, we had a social care hub that worked closely with the volunteer hubs that are still up and running. This time around, because we learned a good number of lessons from the 8,500 people that we contacted through the lists from the primary care networks, our customer first teams will be, information has been sent out to this group, and any of that group can contact our customer first team, and those with social care needs and or health needs will be directed either to their primary care networks, their GPs if they can't do that themselves, or to us so that we can address their needs. At the same time, what we've done is increased more capacity in terms of how we've used the resources in the social care hub from our community social work practice team to work with the primary care teams and also with the hospital, so that we can identify more quickly with GP practices those people that might be at risk of going into hospital when they don't necessarily need to, if they've got low-level acute needs but not sufficient to be admitted into hospital. So we've got a whole wraparound. It's not as comprehensive as it will be in time, because we've been reacting very quickly and doing reasonably well, I think, across the system to make sure that as many people as possible, as the demand increases across the community and in the hospital, that we're working with our commissioning colleagues across the piece to make sure that we're covering every eventuality.
Excellent, thank you very much, Sean, for that. Just a question I have is in relation to outpatients, I guess, and what the level of service is, because I've had a few emails in relation to actually the administration in terms of appointments, and I think it's something that will come out of our review, that actually when people go into to have an appointment, once they get to the hospital is all very well. Actually getting to that stage, it's not quite as straightforward, I'm sure. So it's something we'll probably pick up on at a later stage. I'm going to bring in, I've got Councillor Barnes first of all, please.
Thank you, Chair. I've got a couple of questions. One of which is in relation to the hospitals, and have we any evidence that the way in which GP practices are currently operating is creating additional pressure on the A&E, because people are going to A&E because they can't see their GP as they used to? So is there any evidence on that? And the second one is the pilot scheme at the care homes in relation to letting people, family loved ones visit. How is that pilot scheme currently working? How's it operating? And is there an end date to that? And do we know what it's like, whether it's likely to be rolled out to other care homes in time for Christmas?
Thank you, Councillor Barnes. In fact, you prompted me. I've got on my list the home visiting, and I missed that as I was going down, so I'll update you on that as the second point. As far as the demand and the activity from GP practices, the primary care networks, as I mentioned, we have regular, daily now, silver calls, and also with the weekly gold call that includes GP colleagues on both calls, and they are saying that the level of demand at their end is great, and it's as high as it's ever been in terms of that, and that's why we've agreed to work with them to see how we can work, particularly with the most vulnerable groups. So there's been some risk stratification work taking place that we're involved with from the council to identify that group of people who we feel are presenting to the hospital that could be redirected, well, not actually redirected. Hopefully they don't get to the hospital, because we can pick up on and work with them sooner in terms of being isolated, or particularly who are at risk of falls, so that we're targeting that group to work with them. But in essence, if GP colleagues were on this call, they would say that in fact they are as busy as the acute trust, and the demand is just it's squeaking at the sides right across the system. As far as the care home visiting is concerned, we had Ian convened a meeting last Friday with the registered managers, and it went really well. There was a really high level engagement in terms of both numbers and ideas around looking at the guidance, the recently published guidance from the government, and how, not just in addition to the 4 homes as far as the pilots were concerned, but a good number of suggestions from the homes themselves, from the providers, in terms of other ideas really that we could actually kind of use or look at over the next few weeks as we get into winter. So the outcome from that meeting was that our business relationship managers would start to, which had happened already, to work on the pilots really quickly, because time is of the essence for the obvious reasons. And we would also look at the other suggestions and make sure that, as far as those providers that were smaller, that had less of a voice, that we were working with them too, because part of our issue, again, as people are aware, I'm sure, as members are aware, I'm sure, is some of the buildings just aren't conducive for any kind of, sorry, shouldn't say any kind of visiting, but certainly the type of visiting that we're looking at in this pandemic. So we want to make sure we can kind of sweat that as much as possible. And there is some funding that we have access to from our commissioning colleagues that we want to use to enable visiting for loved ones from families in those more inaccessible homes, so that the modern ones and the bigger providers will be able to get those arrangements in place with our support. But we want to make sure that the medium and smaller providers are also doing that, because you know, in terms of the 1,400 people we're supporting across the piece, particularly over the winter period and Christmas, we want to make sure that as much access that is safe as possible can take place. So we can certainly feed back to you through the cabinet updates, member updates on a daily basis, but certainly weekly basis, in respect to the outcomes of the pilots and the other suggestions.
Thank you, Sean. Councillor Metcalfe.
Sorry, Chair, can I just come back? So
very
have,
quickly, if you don't mind.
I just wondered, is there a definitive date that we're looking that this will be completed by? Because this is like this has been talked about for a number of weeks. I just wonder whether there's a time frame within this.
Well, the time frame is immediate. I mean, in terms of the completion of that, we haven't fixed a date to it as such, because we're aware of the necessity to get running with it straight away. But as far as I'm aware, we haven't fixed an end date to it, because there will be pieces of work that will take longer with those homes that are more difficult to create visiting opportunities for. So that may go on for a few weeks more until we can resolve it. But certainly in terms of other homes, the work is all underway. So there won't be an end date necessarily. There'll be staggered dates in terms of more homes, hopefully, having access to visiting.
Excellent, thank you for that. Councillor Metcalfe.
Yes, thank you, Chair. I just wanted to mention that quite a bit of the quite substantial feedback that Sean's now given, I've put a number of these points in my report, which members will receive tomorrow for council. I expect that with this whole area being so fast moving, I expect that will change again by the time we meet at full council. Obviously, I can't cover it in the kind of detail that Sean's covered it today so well, but nevertheless, I've picked some of those issues up and reported on them in the report. I was going to mention care home visits, because that's the one area that I get more contact about than anything else. And I do know the concerns, of course, real concerns that families and residents have on this. And I know that Ian, Sean and his team are doing all we can now to move, and with of course our providers, to do everything possible.
Excellent, thank you.
I
Thanks
know
for
that's
that.
I just wanted to mention also that we are having contact, and I've had a lot of contact with Alzheimer's Society. They've issued a number of briefings on this, and they've in fact issued another one today on care home visiting and testing. And I think they've copied in, amongst others, the Director of Public Health as well. And so I'll be looking into just what their latest update is, because they have been quite very active nationally, regionally, and locally on this issue, and contacted members, because I've had quite a lot of feedback from other councillors being contacted by them on the previous briefing. So we'll be looking more into that as well. So it's a fast moving area.
It certainly is. Thank you, Councillor Metcalfe, for that. So I'm going to bring in Helen Hunter from Healthwatch. Welcome, Helen, as always.
Thank you. So I wanted to just make a couple of points and ask a question of Sean. So it's really great news to hear about the care home visiting. That's fantastic news that there's progress being made around that. Just so that councillors are aware, there is currently a survey that's live that's been delivered by John's campaign, which is about kind of visiting in care homes, in case anybody knows of anyone who would be interested to contribute to that, and we're promoting that at the moment, so you can get information about that through us. I'm mindful, Sean, of what you said about the fact that more people are choosing to stay at home and receive their care at home, and the fact that although that means that we need to have more robust home care services, it also probably means that we need more robustness in terms of unpaid carer support, because actually it probably means that there are more family members who are offering a higher level of support than they might have done previously. And it just made me think about the fact that we shouldn't lose sight of that. But the thing I wanted to ask a question about was, and it's just for assurance really, is about if people are currently in receipt of sort of home care services and then they contract COVID-19 through whatever means that might happen. I just wanted some assurance about what support remains available to them and what kind of clinical support they might be tapped into to stay at home rather than going into hospital, because I just think that that's something that we, obviously because we're focusing so keenly on making sure that people are safe in hospital and care homes, I just would like some assurance about that particular part.
Yeah, absolutely. Karen may want to add to this as well. I mean, certainly in terms of our home care providers, because we've recently moved to a new framework, a lot of work and obviously resources in terms of PPE and guidance has been given to them, again, via our contracts colleagues and other services, to make sure that they're practicing as safely as possible with people in their homes. Where there are situations where people are COVID positive, then measures will be put in place to make sure that the support can still go in the way that it would in any household. And it will probably be obviously be undertaken by either the existing group of staff, or it may be another group of staff, depending on their status. And we make sure as well that they're tested regularly too. So we try to ensure that it's as normal and consistent as possible, because again, we've got people now who are living at home, which is terrific, with more complex needs right across the board, whereby consistency of support is really important, but then it's made more problematic by the current circumstances that we're in. So it's on a case-by-case basis, but there is this, we reiterate the adherence to public health guidance and PPE.
Thank you, Sean. I've just got two more people, but if you can keep it very brief, because I'm conscious of time and other members that have to be elsewhere. So, Councillor Hutchinson, please.
Regarding supplies of PPE, it's good to hear that volume-wise we're fine, but I wondered how much of it is actually being sourced from local manufacturers, because the government made a pledge to source 20% of PPE from home manufacture. And obviously it'd be great if the stuff we were using was being made around here. But last week, there were complaints from manufacturers in the Midlands that the government is now insisting that all PPE is bought through central procurement, which doesn't allow for local sourcing. are we having the same issues as they are in the Midlands?
I'm afraid I'll have to get back to you on that, Councillor Hutchinson. In truth, I don't know the answer to that question, but I'll certainly get back to you probably by tomorrow in terms of the sourcing. My suspicion would be that it's not necessarily that we are sourcing 20% of the PPE locally, but I could be completely wrong there, because I'm not as close to the procurement of that as other colleagues are, but I'll find out and give you a response.
That'd be brilliant, thanks.
Yeah, no, thank you, Sean, for that. So, and Councillor Marilyn Greenwood, please.
Thank you, Chair. Yes, Sean, I was interested that you mentioned this pilot for visiting in care homes. Is this a rigid arrangement that all care homes will follow, or can individual care homes adapt it slightly for themselves? What is the arrangement?
It will depend on the circumstances of the home. There are pretty clear guidelines that all homes will have to follow. Hence the close work with the council and CCG as well, with other partners to ensure that whatever arrangement is in place, and they can be different. There are certain kind of models of visiting, but depending on the setting, the nature of people, the needs of the people being visited and so on, and numbers of staff, and proximity, you know, if the corridors are small, there will be different ways of having to do it. So I can't, there isn't a one size fits all approach. Hence, in terms of my response, it really depends on the setting. But what we want to ensure is that every setting has the opportunity to have safe visiting.
Yeah. Chair, can I just quickly,
very quickly,
something there? One care home has started with an hour per week for a family member, but it's the same family member per week. So other family members cannot visit. Have you heard this? Is this what's happening?
Yeah, there is. We want to keep the numbers of people visiting their loved ones to a minimum. Now, that can be one, but there could be consideration for another family member as well. But the numbers are kept to a minimum to avoid the potential for spread. So there can't be full family visits, but only one or two.
Okay, Sean, thank you very much for that. Thank you.
Excellent. Helen Hunter's, we're going to send out a link to the John's campaign, so Helen Hunter's forwarded that, so we'll make sure members receive that. I am going to move on, so I'm not going to bring you in, Councillor Swift, at this stage.
If you don't, excuse me, Chair, I would like to make a point on what Sean has said. So, you know...
Well, very, very briefly then, please.
Right, well, it's obviously not important, isn't it? Sean, I don't want this to sound critical, but if all this is working so well, why have we just under 50 people waiting to be discharged at the hospital that they haven't got community resources to do?
There certainly aren't 50 people in Calderdale. Across the piece, in Kirklees and Calderdale, there'll be, on any given day, more recently, probably about 40 on average in Calderdale. The people that have been waiting for discharge have been between 15 and 20.
Yeah. So it's not quite as good as we thought it was going to be.
In what respect, Councillor?
No, I put you in a difficult position. Just ignore that one, Sean. I'll take it up.
Sean and Karen, thank you for the update on that, and thank you members for the input. We do welcome the inputs, and so we can, if we can move on to item number 6, which is mental health service. So Andy Bell, welcome to the meeting. I understand that you are going to take the first bit of this presentation.
Yeah, thank you, and thanks for the chance to be here today, and thank you also for debating and giving this bit of the session over to mental health and the mental health impacts of the pandemic. I know you've just been speaking about the pandemic, so I think my role here is just to give you some of the evidence we've got nationally from what we've managed to collect, and I'll tell you the organisation I come from properly in just a moment. And hopefully there are some slides which I think Alex is possibly working on putting in front of you now. If there isn't, I will just speak rather than create embarrassing gaps. So do you want me to just go ahead?
Yeah, go ahead. Yes, please. Yeah, that is super. We can see the Alex is now sharing the screen.
The magic is happening, right?
It is. It's happening now. There we go.
So there we are, and so I work at an organisation called Centre for Mental Health. If you haven't heard of us, that's fine. We're a national not-for-profit organisation, and we're independent, and our work is about using evidence around mental health, first of all, to ensure that everyone has a good chance of good mental health, but also to reduce inequalities in mental health, and particularly ensure living people with mental health difficulties have a fair chance in life. So throughout the pandemic, what we've been doing is keeping an eye on what's going on, really sifting through the evidence to try to understand what impact it's having on people's mental health and on people living with mental health difficulties, and to do that not because it's interesting, but because we need to help decision makers, people in local authorities and in national government and everything in between, to know how to use resources and what responses would be most helpful for people. So if we can have the next slide, Alex. Just to start at the beginning, and apologies if this is really obvious to you, but I thought it's important to start with first principles. Mental health is something that we see as being on a spectrum. Very often when we talk about mental health, we immediately think of mental ill health. And rightly so, because about 1 in 4 of us today is living with a mental health difficulty which has a significant effect on our lives. But we also know that we're all of us somewhere on this spectrum. Every single person on this Zoom call is somewhere on this spectrum, and I hope as many of us as possible are down towards the green end of this, but we won't all be. And that's the reality. And all of us will spend during our lives time on different bits of this spectrum. And so across our lives, about 3 in 4 of us will experience a mental health problem at some point. Some people for a long part of their lives, others for just maybe once or twice. But what we know is that the things that determine our mental health are about what happens in our lives around us. Things we call risk and protective factors, things that put your mental health at risk and things that protect your mental health. Next slide, please. So up until the pandemic, here are some things we knew about what was going on in terms of the nation's mental health. And again, this is across the whole country. First of all, we've seen a gradual increase in rates of poor mental health. It hasn't been a kind of sharp increase until recently, and that surprises some people because we hear lots of talk about a crisis in mental health. But what we have seen is a gradual increase and a particularly notable increase in poor mental health among young women. But we've also seen, and it's become really, really clear, that our mental health is linked to social and economic inequalities. If you're poor, you're much more likely to have mental health problems than if you're well off. If you're Black or Asian, you're much more likely to have mental health problems as an adult than a white person. So many different gradients, and of course these affect people in multiple different ways. Women are much more likely than men to have poor mental health. Next slide, please. But in terms of what we know about what's happening now, so one of the things we've been doing is looking at things like surveys that have been produced. We haven't done a survey ourselves, but every other mental health charity has. But we've also looked at evidence from abroad, particularly from China, where of course the pandemic has been around a bit longer, and indeed previous natural disasters. And what we can really clearly see now is that there has been a sharp rise in what we'll call emotional distress, not necessarily mental illness, but people suffering really seriously low mood or high anxiety. And what we see happening as things start to subside, and particularly as the lockdown began to ease in the late spring, is that many people bounce back and the effects aren't long lasting. But for some, it crystallizes into things that you can start to describe as a mental health problem, such as anxiety and depression. And in some, what we're seeing is the beginnings of serious traumas that can have a later effect. But perhaps surprisingly, referrals to mental health services, particularly during the beginning phase of the lockdown, dropped like a stone. And of course, that's not because the needs weren't there, it's because people didn't feel able to go and get help. Next slide, please. So this is where we really start to think about, well, why is a physical health problem in society causing poor mental health? And it really comes down to the fact that this is a traumatic event. Most traumatic events in life happen to one or two of us at a time. An experience of violence and abuse, for example, or being a victim of a crime, suffering a bereavement. But this is a collective trauma. It's happening to all of us at the same time. But the reality is we're not all experiencing it in the same ways. And we know that for some people, there is a greater risk of the trauma that we're experiencing leading to poor mental health. That may be those who are most affected by the virus, particularly those who sadly have been bereaved, those who've been most traumatized by the lockdown, for example, children in homes that aren't safe, and women, and people most affected by the recession, the economic effects, people losing their jobs and losing their livelihoods or fearing that. But we also know that traumas collect over life. So people that have had many traumatic things happen to them before, whose mental health was poorer before, they'll be more affected than others. So again, we need to remember these inequalities exist almost across the piece. Next slide, please. I will come on to some positives, by the way. So here are some groups that we have seen already are experiencing greater risks than others. That doesn't mean that these are the only groups experiencing difficulties, but we know, for example, that lockdown was particularly tough on children. We know that people living with long-term physical conditions have gone through all those weeks of being shielded, the worry, the extreme worry of not knowing how safe you are going out. And we know certainly that people living with mental health problems already, many experienced difficulties during the first lockdown in getting access to basics like food and medicine. And there wasn't the help available first time in many places. So that's something we need to be really mindful of coming into the winter. Next slide, please. So sometimes this is talked about as a tsunami, isn't it? A surge of mental health difficulties. And I slightly want to challenge that, because I think what we know and our research has shown that we can estimate now that about 10 million people in the United Kingdom as a whole are likely to need mental health support because of the pandemic. That's a lot of people. And we know most of those are people who already had poor mental health, but it's got worse. But it also includes 1.5 million children. If I did a quick kind of back of an envelope thing to work out in an average top tier local authority area or unitary, that's about 66,000 people who will need support for their mental health, more than they would have needed had this not happened. But it doesn't happen immediately because people don't always seek help for their mental health immediately. It takes time to recognize you've got a mental health problem, and there's still issues of stigma and fear and not being sure whether it's all right to ask for help. And for some people, the impacts may take a long time to happen. Certainly traumas can take years before they begin to really take effect. Next slide, please. So there's loads of things councils can do, and here are just some that we've looked at with certainly with our work with local authorities through the Mental Health Challenge, and there's many more. But I think crucially what we see is a real need to be aware of which groups within your community, which citizens are at greatest risk of poor mental health from the virus. Think about how we can prevent mental health problems, and that's often about creating safe spaces for school children, college students, people going back to work, people working in strange ways, to feel safe and have policies, for example, that enable people to work more flexibly or give people a bit more time off for bereavement, for example. Supporting people with mental health needs with things like physical health and food and having money coming in. In the first lockdown, there were some easements to some of the more coercive elements of the benefits system. Sadly, they haven't been continued now, so we need to make sure people have money coming in. Working with and alongside community organisations can give fantastic insights. And again, local authorities can do a lot just to make sure that some of the more vulnerable community organisations can keep going. And I think crucially look after your own mental health, because my goodness, everything I see about working with local authorities is being a councillor is hard. And working in a local authority public health or social care team is hard. So you need to think about your own mental health too. Next slide, please. So looking more long term, and then I will shut up, promise. We've been looking recently at what a more equitable mental health system would look like. And again, this is where councils can really make a difference, because we know, as I said, that the determinants of our mental health, the things that determine our chances of having good mental health, are far from equal. And we know very often it's the people who have the worst mental health, who have the poorest access to support and the least good experiences and outcomes. And councils, by building links with communities and services and civil society organisations, can really begin to turn the corner on this. We published a report last week, and we're now looking to work with local areas that want to go on this journey to think about how mental health equality could be more of a feature of the places that they support. Next slide, please. And that's it. Here's some resources we've made. I hope you'll want to download these resources and make use of them. There's a piece about looking after your own mental health. There's a piece about local councils, which I've roughly talked through. And then there's a toolkit for looking at what mental health needs may well happen in your local area using data from research. And that's enough from me. Thanks so much for listening.
Thank you, Andy. That's really most informative in so many different ways. Perhaps we can share the resources on the members hub. Actually, that would be quite useful. I think people will possibly agree. Councillor Stephen Lee, would you like to come in at this stage? You're just on mute, I'm afraid.
Thank you, Chair, and thank you, Andy, for an excellent presentation. I've just written down a few jottings here as we went through that, and so I'll share them all with you for some further debate. The first thing, seeing the figures, which I found absolutely alarming and surprising, is many years ago when I was a boy, mental health was never discussed as a topic, mental health. So I just wonder presumably there was still a high incidence of it then as now. So what did it used to be called? How was it kept from the general public that there was a problem with this? It was seemingly not on anybody's horizon many years ago. So I wonder what it was. But secondly, and coming back to date and trying to apply present circumstances to this, I'm just wondering, is COVID denial, which some people seem to have at the moment, and say immunisation aversion, even now we've got some solutions coming up, and failing to observe social distancing and wear masks when they should. Are those things in themselves, individually or conjoined, are they mental health issues that people are just so full up with the difficulties now? Would that come under the category of mental health? And my final point is, and this comes back to, I think Councillor Barnes mentioned it earlier, we'll talk about it later, no doubt, but where would they go? There is a big problem getting into CGPs if you feel you've got a problem. So the only place they can go is A&E. And so, when people say A&E are swamped, it's no wonder, because lots of people are suffering in different ways right now, and they've got nowhere to go. So just a few things there. Andy, I don't know if you care to respond to any of them, but I hope you kind of get the gist of my observations. Thank you, Chair.
Andy, would you like to come back in on that at all, or?
Absolutely love to. Thank you, and thanks, Councillor Lee. Great questions. I'll try and be brief, just in case there's others. But I mean, the history of mental health is a topic all of itself. We could spend hours talking about it, and I shan't detain you with it. But I think the reality is, poor mental health is consistent in almost all societies around the world. You see roughly consistent levels. This 1 in 4 comes up time and again, no matter where you are in the world. It's slightly lower in developing nations and was probably maybe slightly lower in the past, but not much, I don't think. And I think realistically, we used to talk about nerves very often, and I think still today, we tend to find physical explanations for poor mental health. So very often people will describe having various physical symptoms, which may or may not be real, and very often they are, but often poor mental health is implicated in them. And there was just a fear of talking about it. So there was a kind of whispering, if you like, and I think we do that less now, and that's a real sign that we're making progress. And I think that shows that actually we are seeing some real momentum on this, and it's good that we are, and we're having this conversation today. I wouldn't call COVID denial or failing to do the things you need to do a sign of poor mental health, but it may be. I think we also see for many people a fear of leaving the house is also a sign of poor mental health. So you probably get the opposite, where people are just terrified even to go out and go down to a shop because of the fear. And I think one of the things we have noticed is that good, consistent, compassionate, empathic communication from government and indeed local government is really important to help our mental health, as well as our ability to comply with the various instructions we're given. And I think that's something that actually I've been really impressed with, the way local authorities and public health directors have communicated with their citizens and provided a kind of consistent and truthful and honest message about what's going on and what we need to do. And I think that's really, really powerful. And in terms of where you can go, I mean, I think the reality is that people do sometimes find it hard to get help for their mental health, particularly from the NHS. Services are out there. Obviously, GPs, they can see people remotely. Often people struggle to talk to their GP about their mental health. And that then comes down to the skill of the practitioner in having a conversation with someone that brings it out. But we also know that talking therapy services are available. In some places you can refer yourself, so you don't have to go through a GP. And there are lots of online services increasingly as well, particularly aimed at young people, that avoid the need to go to a therapy service at all, but provide kind of self-help and advice. And there are lots of advice lines for everything from Young Minds that provide specialist advice to parents, through to Mind and Calm, and many other organisations that provide help online.
Thank you for that, Sandy. I'll bring in Johnny Richardson. Glenn, welcome, Johnny. Perhaps you'd explain where you're based and coming on this. I'm just looking. Yes, hi there. Yeah.
Certainly. Thank you very much. So I'm Johnny Richardson Glenn. I'm Chief Officer of Healthy Minds, which is Calderdale's main mental health charity. So we are one of the places that people can go. In response to Councillor Lee's question, we're available to everyone in Calderdale from school age through to old age. So we don't have referral criteria. We try to be as open access as possible. Anybody can get in touch with us. So that's one thing, but I just wanted to follow on from Andy's presentation, which I think was really good, and I wondered whether a local from one of the local providers might be useful in getting across how this resonates. So pretty much everything that Andy has said just was sort of chiming absolutely with the experience we've had in Healthy Minds, and certainly on a local level, that sharp rise in demand. I was just jotting down some figures here. So in March, in addition to all of our usual activities, we run groups and mental health education, and we work in schools. In March, we had 30 inquiries through the month about what sort of services we offer. In April, that was 217. So that's indicative of the sharp rise in demand that we've seen just from March to April. And that has continued on that sort of trajectory. So since March, we've dealt with over 2,000 calls, and that is inquiries sort of in addition to the normal services that we routinely offer. Among the services that we have is out of hours crisis support. So this is called Safe Space. It has through lockdown. It's been available on the telephone and online. And again, we've seen a sharp rise in demand there. So for example, from January to March, we had 456 contacts in Safe Space. This is a service that operates in the evenings. And from in the first quarter of 2020, so it'll be April, May, June, that rose to 720. And it was over 800 in the following quarter. So we're seeing that demand that Andy has so well articulated. We've seen that on a local level. This is the kind of demand that we are experiencing as a mental health charity operating across Calderdale.
Thank you, Johnny, for that. So I'm going to bring in Councillor Barnes.
Chair, actually, Andy has just put in the guide in the chat, which was my question. So I will defer.
Fabulous, thank you for that. So Councillor Marilyn Greenwood.
Thank you, Chair. Yes, thank you for your presentation, Andy, and Johnny. I heard some good things about going into schools. My main concern is, I mean, I'm sympathetic to everybody that's coping with lockdown and the way it is, but I know specifically young people. We're all social animals anyway. The majority of us are anyway. But young people need to get together. They need to mix with the peers outside school and things. They can't do this, and it must be dreadful being in those teen years and being stuck at home with your parents. The last thing any person of that age wants to be is at home with the parents. And it must be so difficult for them. But do they know in school where they can constantly get this help if they're feeling really at the end of the tether with how things are? Are there counsellors that can help them within the school? Is this information at their fingertips? I think that's what the question I meant to ask.
Yeah, good question. Johnny, would you like to respond to that?
Yes, I can. Calderdale's mental health offer for children and young people has been growing, and it is actually it's considered on a national level as quite an innovative response. So lately, what's happened is a lot of providers have been brought together. So you have your traditional CAMS, child and adolescent mental health services, which are NHS services. What's happened lately is that that's sort of broadened out. So a Healthy Minds project is called Time Out. We go into schools, we do mental health education in schools, and that includes sources of information and support. Among the things we do with that is we do drop-in sessions for emotional support in schools, some schools, I should say. And we increasingly do specific courses on pupils who have been identified by the schools as needing a bit of extra support, so we can work with them in small groups to explore what's going on with them and find the best ways through for that. We relate well with CAMS and Noah's Ark Centre, which is another voluntary sector counselling service. So the provision within schools and for young people is certainly growing, and I think the information channels to young people are much improved. I think the information is fairly readily available, and Calderdale actually has a really good website, Open Minds Calderdale, which has huge resources, and that's for children and young people and parents and professionals who work with children and young people. So there's all sort of different levels of information on there. It is a very good resource, and I know speaking with people in other areas around the country, that it is sort of regarded as being up there as a really innovative offer in Calderdale.
Thank you, Johnny, for that. I'm going to bring in Councillor Savvy Whitaker then, and I'd like to hear from Swift, the CCG, and Libby in our own council. So Councillor Whitaker, please.
Thank you, Chair. Thanks, Johnny. The government has allowed during lockdown for support groups to meet face to face, and I'm aware that Andy's Man Club, for instance, are doing that. Do Healthy Minds, are they doing a face-to-face support groups, and if not, why?
We are not doing face-to-face support groups. We have converted all of our groups into telephone conferencing or video conferencing according to the wishes of those groups. We have taken a steady and cautious approach around the guidance on these things, and it's not just what we are allowed to do, it's what we deem safe and responsible to do. It has been felt that, as well as exposing staff to risk who would be facilitating those groups, you know, we do work with a lot of people who would fall in high risk categories, and we didn't want to expose them to unnecessary risk. So the support is still available to people. We have a concern about people who don't have, you know, computer or internet access. So we're trying to broaden that the means of contacting more widely. But that's the approach that we've taken. So whilst we are allowed to meet in support groups, we've chosen not to. And I think we've had sort of broad agreement on that from people who remain involved with us.
Yep. Okay. Thank you. Do you want to come back on that? And Councillor Whittaker has.
No, thank you, Chair.
Yeah,
Thanks,
no. Okay, if I can bring Sue Sutcliffe, thank you for joining us, Sue. If you'd like to perhaps give your perspective in terms of SWIFT.
Okay, yes, thank you. My name's Sue Sutcliffe. I'm General Manager for Community Services. I believe, are you just wanting an update with regards to where we're at with local service provision from a mental health?
For mental health, yeah, absolutely, and the issues moving forward, I guess, in some ways.
Yeah, well, okay, I'll do a summary of where we're at, and perhaps reflect on the presentation that we've just seen, and just provide a bit of a comparison with regards to the local picture, and then I'll hand over to Libby to deliver a presentation that we've pulled together with regards to moving forward and transforming mental health services. I think it's fair to say that we certainly have seen a lot of the trends that were captured in the previous presentation, that we certainly saw a reduction in referrals early on, around about March time, when lockdown first commenced. And it was quite a significant reduction. However, I think what it is important to note that perhaps the presentation didn't pick up was that what we saw was people with certain types of presentations around that time starting to deteriorate. So service users who were in receipt of secondary care and enhanced mental health services, we saw quite a marked deterioration of their mental health, and that was particularly around people with a psychotic presentation and people with bipolar, and we had to manage some quite significant incidents as a direct result of those, and I think more recently, referrals have started to rise and resume, if not at times exceed normal referral rates. So that's just some local information with regards to how we would compare to the presentation. Just with regards to how we've approached the COVID period, I think it's important to say that all SWIFT services have continued. We may have had to adapt how we deliver those services, and we may have implemented an approach around contacts that's based on risk assessment, but we haven't ceased any of the key functions of mental health services. We very quickly developed a business continuity plan. We shared that with the other local providers and update that regularly on the bronze, silver and gold calls. And that clearly describes what action we would take should certain circumstances come into play. So, for example, if staffing levels became so challenged that we had to start to focus our plan and delivery on core needs. And then more recently, towards the latter end of wave one, we started to pull together a reset and phased recovery plan where we were able to start to readdress some of the balance of contacts. And for example, we did do more indirect contacts early on in the period, telephone, and then we started to use some of the IT platforms such as the one that we're using now. It's proven to be very effective for service users that can engage in that way. We've always recognised that some service users will not be able to do that, and when they have heightened need, we have carried out our normal contacts with them. So the recovery plan is very much about perhaps restoring some of the face-to-face based interventions, and that's progressing well. I will say that we have, as other providers will have had to do, we have had to carry out buildings risk assessments on all our premises, and that does limit the way that we can use those. So we are having to recover and implement that recovery plan in line with those strict buildings assessments, and that's to keep our staff and service users safe. So all crisis services, that home-based treatment and mental health liaison, which work within the A&E departments, have continued to operate in full throughout the first and second wave. So as I've said, we feed in, we continue to join our other partners in the bronze, silver and gold meetings. We continue to look at mutual aid, whilst that's challenging because obviously we have to keep essential services going. We do have active conversations about the possibility of sharing resources and supporting other elements of the whole system. Mm-hmm. So I think basically that's a sort of summary of where we are now. Unless there's any questions, I'm happy to sort of hand over to Libby and Janice with regards to moving forward and transforming mental health services.
Yeah, thank you for that, Sue. I think we do have a question from a councillor. I think one of the, you're probably aware that we carried out a review last month, which we are coordinating and putting a report together. I think one of the issues which is established from the mental health is actually the physical face-to-face contact. Actually, people want to get out of the home. And actually, that's part of the problem in so many different levels. So whilst I very much appreciate what you've had to do, I think actually it's had an increased bearing in terms of some people and how they've actually felt, which as I said will be picked up in our report at some stage. So I'll bring in, if I can bring in Councillor Clark at this stage. You did have a question specifically for yourself, I think.
I did, thank you, Chair. It's about the referrals, and is the time span for first contact after referral, is that increasing because the number of clients have increased, and the IT-based support and contact, does that have actually a positive effect on the number of people that you can see per day or per week, per month? Yeah.
It does, yes. And I have to say, the use of IT platforms is not a new phenomenon. It's something that we've always wanted to use, and have been attempting to bring that in, because it is very effective for people that can engage with us in that way. Obviously, you have to be very careful because, as we see from this scenario now, you know, running a group or whatever via Teams, or we use other platforms, is quite difficult, and it requires a slightly different skill set. But it means that those who don't want to go out can still engage with some therapeutic contact. Where, I suppose, just to link in with your first question, where people voice a very strong opinion or do not have access to the required IT equipment, and you know, not everybody has a computer, and not everybody, in fact, has a mobile phone. Where that's the case, that person's needs is individually assessed, and we will adapt the approach that we take according to the level of need and the way that person would require that need to be addressed.
Okay.
Excellent. Thank you, Sue.
Thank you very much.
Yeah, thank you. If I could bring Janice in at this stage, if that's okay.
Hiya. Hello.
Oh, hi there. Hi. Welcome, of course. Yeah.
Thank you. I think it'd be really helpful to build on what Andy and also Sue's just said, in terms of, I put it in the chat, we have recently updated a resource pack of services and support, what's available within Calderdale and nationally. So I can circulate a copy to Alex if people are interested in seeing that. Some of the things what are in there are details of like the 24-hour, 7 days a week mental health crisis line. So those kind of supports and bereavement and grief kind of helplines, etc. And I think it's fair to say, kind of Sue was saying, actually some of the service offers within both Swift and our voluntary sector have been quite creative in how they've reached out to people. I've been really mindful that we want to offer a range of interventions around what might best fit with people, how people want to receive the service. So some of those things, I know that the Recovery College have sent out lots of art packs and things for people who might kind of have an interest in that as well. I think thinking around what Andy was saying in terms of the likelihood of an increased level of demand, we are, as a system across Calderdale, looking at some work to do a bit of modelling using the tools and the forecasting tools that I think is Nick O'Shea, which is some national work what's taking place, so we can understand what that might mean for ourselves. I think we started to be really linking in and kind of considering the elements around those really wider social determinants and how that impacts on people's emotional kind of well-being. We are really mindful in terms of, obviously, kind of Calderdale's has seen a real increase in the number of people claiming benefits, and unfortunately, sadly, a real reduction in the number of job opportunities for people. Obviously, as we kind of move through furloughing, then the implications from an economic perspective and the impacts on people's mental health, we need to kind of consider that as well. So we're doing a piece of work with that. And we will talk later when we talk about the transformation of community services. We've got kind of some that's clearly clocked in there as well in terms of the model that we're wanting to move forward with. Alongside that work, we're starting to use our population health data from a community base as well to try and understand actually from at a community level, where are we in relation to a better understanding of the impact from a health inequalities perspective. So at the moment, we've got a little bit of work taking place around the BAME community and the impact on their emotional health and well-being because of COVID, and actually what might make a difference. So how can we do something about that? It's great to get the information. We want to kind of think about, so how are we going to respond to that? And we want to use the learning from this approach, which is reaching out to actually engage with the community, to then also think about actually the work we might want to do around the LGBTQ community. Swift have developed some pathways around supporting people who've been in the intensive care unit, so reaching out, because we know that's some vulnerable issues and those people might need some more detailed support at that point. And both our IAP providers
We've just lost the last part. Just repeat the last part a little bit.
in Calderdale are also reaching out to try and do some work in care staff. All right, I'm going to just take my video. I'm going to take myself talking about some work that's been done in care homes. Fab. And then kind of the final thing is also we have just entered into there's a national NHS campaign what started a couple of days ago, which is absolutely about supporting people experiencing anxiety or depression to kind of come and seek help. And that's called Help Us Help You. We're in the midst of circulating that detail as well. So that's some of the work that we're doing.
Thank you, Janice. That's most helpful. I think what's coming out of this is actually there's so many different links and so many different organisations actually helping people with mental health. But actually, I'd be very interested to put a report together to see the journey of a person with mental health as to where they come into the system, where they go with this, because actually there's been some really useful links, and thank you, Andy, for circulating those, and which will be circulated to members at a later stage. But I think it can be really confusing at the best of times. Probably sending us all to a bit of mental health, trying to understand where to go with some of this. Libby, I'm going to bring you in at this stage, and then I'll bring Helen from Health Watch, and then we'll move on to the second part of the of this, please.
Good evening, people. I've not got an awful lot to add, really, because I think from the local authority perspective, we're very involved with SWIFT. A lot of our staff are within the integrated teams. I think from the main thing from the council point of view is our statutory duty for undertaking mental health act assessments, and what we have seen is that has that's beginning to rise. So similarly to what Sue described, we saw in the kind of the early stages of the first lockdown quite a reduction in the requests for mental health act and care act assessments, but in the recent sort of 2 months we've seen that rise. And as Janice has mentioned, we are using a modelling tool to kind of predict what that increase is going to be over the next couple of years, really, because we see that as a bit of a trend. We have been really successful within our provider sector in terms of mental health on our residential side. We have been COVID clear in all our supported living, and we've continued to be able to kind of deliver our crisis beds, as well as being able to respond flexibly with any other vacancies we've got to support those people who are really struggling with their mental health and on the verge of a hospital admission. I think one of the interesting things that's been quite is our employment service who operate under the individual placement support model. So although we've seen some reductions, as Janice said, in jobs, we've actually seen that service being more successful at getting people with severe and enduring mental health conditions into employment. So that's been quite a surprising little bubble for us within the kind of COVID, and something that we're desperately kind of holding on to and seeing as a real sort of success. I think the other challenges for us really are kind of those people who kind of increase in care act assessments, and we're working across the system and just working collaboratively with Janice and with Sue and colleagues in Swift to maintain the system. We have started being very proactive with some of our social care staff in the secondary services about actually starting those face-to-face visits. I'm going to knock my camera off because I've got a bit of an unstable connection. So, you know, we've got a very clear risk assessment in place to undertake those visits and actually begin to get people out of the house and kind of meeting people in parks and in more of those more public arenas where possible. So we're actually getting that connection back with folk. But that's all I've really got to add from the council kind of perspective.
Yeah, no, thank you, Libby, for that. I'm looking for any members, you know, wishing to indicate. I'm happy to take questions, of course, as always. I'll bring in Helen. Helen, thank you again. Do you have anything to add on this particular part at all?
I've just got a couple of points that I've kind of pulled together whilst different people have been speaking. So obviously you've had a report, like a written report from me that summarises the feedback that we've had through our engagement. One of the things that really struck me when I was looking at the different word clouds that we've got is that the stuff that is keeping some people well is the stuff that's making some people unwell. So being at home more is something that is great for some people, but really challenging for other people. Spending time with family is great for some people, challenging for some people. And so I think that sometimes the solutions that we think there might be are sometimes the things that are most challenging for some people as well. I think it's important to kind of think about that. I wanted to reflect that we've had really quite good positive feedback about the mental health support line that has been put in place during the pandemic. And it's not just during the pandemic that's been put in place to support people. And it made me mindful of what Andy was saying about kind of emotional distress rather than mental ill health, where actually a lot of people need someone to talk to and offload with right now and to kind of seek some emotional reassurance from, rather than needing kind of an ongoing intervention in terms of their mental well-being. I'm mindful that I put something in the chat about a specialist grief and loss service that has been set up during the pandemic to support people who have lost someone. But I think it's bigger than just having lost somebody because they've passed away. It's having lost somebody because you haven't been able to contact them whilst they've been in a care home, or having kind of had separation from your family. It's about that sense of loss rather than just bereavement. And I'm really aware that there's going to be a staff focused a type of suicide prevention campaign that's going to be coming out through West Yorkshire and Harrogate as well, which is about encouraging people to talk to each other, because obviously some of the health and care staff that have been working through the pandemic are the people who will have experienced most trauma with perhaps the longest lasting impacts. So there is a real necessity at this time for making sure that we support the well-being of staff. I'm mindful of what some of the stuff that was being said about children and young people. I think there's a really good offer for children and young people, and I've put another link in the chat to a sort of resource that's been developed. I think it's interesting to think about digitisation from the perspective of young people. I think there's an assumption that young people will feel really comfortable and competent when using sort of video calls or online systems to access services. And actually feedback that we got early on in the pandemic was that once kind of counselling type support had gone online, actually it felt much less connected to what young people were needing, and they felt like they got less value from it. And I think we sort of assumed that it'll just work right for young people, and I'm not sure that that's always the case. And the last thing, sorry, that I wanted to just reflect on is what Andy said about empathic communication and about the value of kind of, I think, sometimes being treated like a grown-up and given proper, honest information about what is taking place, what the risks are, rather than something that's quite like, this is what you've got to do, this is how you've got to comply with it. We need to kind of give people respect and just understand that they can understand a more complex message than just that's very, very basic. And I think that it has a real impact on people's mental well-being when they don't feel like they understand why something is happening or a decision has been taken. So I think that's a really important thing for us to think about in terms of Calderdale's communication. But that's that's quite enough from me. I apologise.
No. Thank you. Your comments are always valued, and thank you, Andy, for attending. I appreciate you've got to be elsewhere. Just one thing, I think you've a number of organisations have provided some extremely useful links, and I think it will be really useful to contact the comms team and send out a press release following our meeting tonight to actually make sure that people are aware of some of those links as well. Equally, the website be on Calderdale as a section where people can easily link to that as well. So I think it's been extremely valuable. Councillor Lee, I think you'd like to raise a question, please.
Thank you, Chair. I found it very stimulating tonight, and in many ways comforting that so many good people and organisations are determined to do something about this. But without wishing to put a dampener on it, there's an issue that I brought to this group before. We've all talked about it. We've all been made aware of it. It's been confirmed that in Calderdale, for a child to see a psychiatrist demands a waiting list of 6 months. So somewhere in between the poor child that needs some help and can't see a psychiatrist for 6 months, which could have all sorts of terrible consequences, I would have thought someone in need needs a psychiatrist straight away. So in between that and all this tremendous desire to help people, young people as well as older people, and young people do get older, how can we accept that it takes 6 months to see a psychiatrist when that could nip things in the bud? And yet there's all these organisations trying to help. It just seems a totally unacceptable imbalance of resources to me.
Yeah, no, thanks, Councillor. I think it's been picked up. I'll just bring in the other members first of all, if that's okay. So Councillor Whittaker first, then I'll bring in Councillor Megan Swift. So.
Thank you, Chair. I think it would be remiss of us not to, well, on International Men's Day, not to talk about or mention male suicide. I was reading some figures just before the meeting, and the highest rates of male suicide and women suicide in the whole UK is in Yorkshire and Humber. And it's the biggest killer of men under the age of 45. I'm not sure who I'm directing my question to, but it was just a question really to mental health services. What are we doing to target suicide, risk of suicide, and people who are on the brink of doing something so horrendous and devastating to the families and themselves? Is there any targeted interventions with this?
A good question. Who would like to come back on that? Nobody's indicated. Everyone's scared of that question, but I think it is one that needs addressing. I'll bring in Councillor Megan Swift, and I do want somebody to respond to that afterwards, please. Yeah.
Thank you, Chair. Just a very quick thing. I mean, there are some of the services for younger people that have been renowned for years for having long waiting lists. I mean, they are still quite long, but just picking up on Councillor Stephen Lee's comment, I'm actually quite relieved if it's down at 6 months. I'd really like it to be down to 1 month, but you know, I can see why it isn't. But I hope that whatever system they use to decide whether a child has to see somebody, you know, they can assess at that stage, and if it's really serious, they can see somebody quicker than the 6 months.
Yeah, no, thank you, Councillor Megan Swift. I think Karen's going to address Councillor Whittaker's question, hopefully.
I am, Chair. I am.
Good.
Not from an NHS services point of view, but from a public health and prevention approach. I can address that. Councillor Whittaker may or may not be aware that we have an obligation from the authority that we do regular suicide audits, which involves going through the coroner's records. And we did one in 2016, And out of that audit, we developed a multi-agency partnership suicide prevention plan that we've been working around, and that has a number of key areas, which I can share that plan later on. I think it's been to Scrutiny before, but this year, just before lockdown, I did another audit of the coroner's records for Calderdale, which covers 2016 to 2018. And we just recently, we've published that report, and we're using that now as a basis of working out our next plan for the next 3 years. And just coincidentally, we actually had a partnership-wide workshop this week with a range of partners from the voluntary sector and NHS and council representatives to talk about what we're going to do moving forward. There's people there from Andy's Man Club, a whole range of different people. And we're developing that across the Calderdale patch around what have we done, because we've done quite a lot in the last 3 years, but what we're going to do for these next 3 years. So that work will continue. But as I say, that's about the prevention side, because we know, for example, the majority of our suicides in Calderdale in the previous 3 years was due to hanging, for example. So thinking about that, that's just a snippet, but that's in terms of prevention. I hope that's answered your question, Councillor Whittaker.
Okay, thank you for that. Johnny, would you like to come in as well, please? Yeah.
Thank you. I think Karen has sort of said what I was going to, which is that there is a collaborative effort in Calderdale to bring providers together and look at trends and actually find some solutions to these things. I think one of the things that we've found at Healthy Minds with Safe Space is that we do get quite good engagement with men in Safe Space, the out of hours crisis service, in a way that we don't with our more general services. It's very much women is the dominant client group across the other adult services. And I think what makes the difference there is that there are different ways that men can get in touch with services. It doesn't have to be on the phone. It doesn't have to be face-to-face. It can be text. It can be Facebook messaging. And that seems to be a good, it feels like a non-threatening introduction. So I think there is just something that, broadening out those ways of accessing services is one of the things that seems to make a difference, particularly when we're talking to men who we know, and this is across the whole system, men do leave it late. They are slow to ask for support, and so they tend to be in more intense need at the point of first contact. So I think there is something about broadening that out. We are going to touch on some of that in the transformation discussion.
Indeed, if I can bring Helen in quickly. Thank you for that, Johnny.
I just wanted to speak, and it reflects what Johnny's just said about the fact that with men's mental health and with the higher instance of suicide in men than in women, actually it's often people who aren't known to services and haven't sort of expressed that they have concerns with their mental health who go on to take their own life. And there's higher instances in areas such as the construction industry. And there's something about the kind of worry, nervousness about kind of disclosing some of the distress that is being experienced. And there's something really pertinent about things like Andy's Man Club, which encourage sort of a first conversation and a first contact that you can just open up, rather than it sort of feeling like I need to go and tell someone I'm not all right, and kind of being able to connect in that way. I think there's something that's really, really important about that. And I'm aware that there's a piece of work that's been done by West Yorkshire and Harrogate Partnership called Great Minds. I don't know enough about it, but that's particularly about engaging with men through sport, and I'll try and provide some information and share that with you.
Yeah, no, thank you, Helen. Okay, thank you for contributing to the first part of that. It's been really useful. If we can move on, I think at this stage to the community mental health transformation. Janice, you have circulated a presentation. Now, have all members seen the presentation? That's the first question I want to raise. Councillor Barnes, have you? So did you? You have, yeah. Anyone else? Has anyone else seen it? Councillor Megan Swift, have you seen it?
I've seen it.
Yeah, I think most people have seen it. So perhaps you'd like to highlight a few things from it, and rather than do the full presentation, so we can go to the questions, I guess, in some ways.
Okay. I think it's also fair to say that this is a collaborative approach, because I think it's absolutely kind of fundamental to our approach that we've got a really exciting opportunity over the next 3 years to look at how we kind of support or change our service offer to adults and older adults with complex mental health needs, to kind of bring that together in this holistic way, kind of with our partnerships with SWIFT, local authority, our third sector. And what we've been talking about is that connection around the wider determinants. So kind of linking things through from housing and kind of benefits to kind of how do we really reduce isolation. And the aim is to kind of look at how do we change that and bring that around and closer to people's communities. The approach we've got is we have established a working group, which is a multi-agency, multifaceted kind of group of people what report into the Calderdale collaborative communities. Perhaps better, people might be more familiar with the care closer to home elements, and what we're wanting absolutely to do in the first year. The bit's gone through, so it's a NHS transformation funding for 3 years to kind of start to look at this and give us opportunities to kind of develop these new kind of pathways where we don't lose people along the way, and people aren't kind of struggle to move between kind of the service element, or it's a very more personalized, holistic approach. I could talk around this for absolutely ages. I'm mindful that Libby, Sue or Johnny might want to kind of contribute, so I'm going to stop and just see if any colleagues want to before we go to questions.
Yeah, super. Thank you, Janice. Libby, do you want to come in first of all?
Yeah, I think one of the important bits about this transformation work is that it really addresses the gaps that we have, because at the moment if you have a mental health problem that is too complex for the talking therapies in IAPT, but not complex enough in terms of severe secondary mental health services, you're in a bit of a grey area. And I think the other bit certainly that's really important to us from the local authority is that prevention agenda. And one of the challenges that we've had is that all our resources sit in our secondary care provision, and therefore we've not had the ability to do an awful lot around that prevention agenda, whereas this transformation programme actually enables us to address that right at that primary care level with the expertise. So I think it's really exciting.
Fantastic. And who else was going to come in then?
Either Johnny or Sue.
Yeah, John.
I suppose the other element around this is about supporting people with the right support at the right time in the right place. It's that element, because obviously we've all got challenges, Swift have got challenges. So if we can do this also enables the expertise that Swift's got to be able to use it in the right way. So
Johnny was
on
that.
I'll just come in and just say something briefly from Swift's perspective. I mean, this gives a secondary care provider like Swift the opportunity to forge some really good links with place-based services, so around the PCNs. So instead of pathways into mental health services coming via our single point of access, the aim is that the pathway starts from within the person's locality in which they reside, and the primary care network resource is enhanced to enable them to begin to identify and deal better with emerging mental health problems, and then the pathway can be facilitated. What I would say as well is just I suppose linking in from a suicide perspective, one of the nationally there is some guidance that's suggesting that there needs to be a number of key pathways developed in all localities, and one of them that we have a deficit within Calderdale and need to do some work around is a trauma-informed personality disorder. Now, I'm not saying for 1 minute that our high levels of suicide are all linked to that type of presentation, but a significant number of people with a personality disorder sadly do go on to take their own lives. So that from a SWIFT point of view, there's something about developing expert pathways to enable secondary care services to really focus on the area of need and expertise that's needed, whilst making sure that the expertise also sits within the primary care networks, and that they can help us by intervening early, but facilitating referrals or pathways where someone does need a more secondary care-based service.
Thank you for that. And Johnny, would you like to come in on this as well?
Yes, thank you. So I guess it follows on really from what people have been saying, is that there are good services that are already available to people. What we've got is the opportunity to sort of join up the offer for people in Calderdale collaboratively, so that those services can operate, at the level that they are intended, that they're specialised for, and so there's more efficiency across the system, and the demand is spread more across the system. And this touches on what Councillor Lee mentioned earlier about the young, I know that was specifically for young people, but the sort of long wait for psychiatry. And I think one of the reasons that has come to be is that every young person who's sort of identified as having that sort of need is shoved into the clinical NHS system. They don't all necessarily need to be if there were viable alternatives that were offered to them. What that does is it clogs up the system. So a lot of time is spent on referrals and assessments for people that probably don't need that degree of intervention in the first place. So if we can get those sorts of things right at the early stages, we get a better flow across the system, that people more speedily access the level of support that they actually need, and that specialist services can focus on what their expertise is all about. So rather than a community psychiatric nurse spending a lot of their time helping somebody with, say, welfare benefits issues, they could more meaningfully spend their time on a sort of therapeutic intervention, and that aspect of things can be picked up elsewhere in the system. So that's what this is about, is increasing the capacity by having more entry points and soaking up that demand with a sort of a bigger sponge, if you like, rather than just trying to lob in lots of little bits of sponge. And
I suppose to find another point.
You're just breaking up, Janice. Do you want to turn your screen off? You might have a better reception. Sorry.
It's actually what you've just described, John. Is actually.
You're just breaking up again. So yeah, no, it's really bad. we're still having difficulties. Perhaps you'll hold those thoughts for a few moments, and I'll bring Helen Hunter from Health Watch in at this stage. So welcome back, Helen, and always appreciate your reports. Are very, very comprehensive and very well thought out. So thank you, Helen. Perhaps you'd like to give us just sort of a summary, I guess, in some ways.
What I was thinking then was listening to kind of people talk about this new approach to working actually speaks to an awful lot of the feedback that we have heard in the past few years. I'm mindful that one of the biggest pieces of feedback that we get is about a sense of people being moved from place to place. And so it's really important to me to have that sense of embedded. If you approach through one contact point, it's not then down to you to contact all the other potential contact points, that you have that flow from one place to another, and that connection is there. Because I think that you're not all the right person to answer the question, but when you are feeling distressed, to be told, actually, no, you've come to the wrong place and you need to go somewhere else, is literally just adding something else onto the pile of worries that you might have had anyway. So something really, really pertinent in that and in the conversation that's taken place, and what's been articulated as the change that's coming.
Yeah, no, thank you, Helen. I think there's been some really important key elements where we certainly need to come back in, I think, in 6 months' time, because I think the picture will have equally changed as well. And just looking for any members really, any specific questions. I know there's been an awful lot of information to take in. It's been I think it's been a really useful session. I hope members will agree. And so bear with me with the timing of the meeting itself. No members have indicated to speak on this. So I think there's a few key elements. Oh, Janice, apologies for the poor connection. Just wanted to highlight was improved outcomes and working with people to design the offer, which will piloted over a number of PCN areas. So yeah, thank you, Janice, for that. I think that needs to be incorporated. So what we have had this evening is a lot of useful links and information, which, as I said earlier, I think one of the recommendations here is that there should be a press release so that it's widely known in the public domain as to where people can actually obtain help and assistance. I think the other one is I think it would be useful in 6 months' time to put together a story, a journey of a life with a person with mental health conditions as they walk through the door, where they get support and where they move forward. And I think and the other one I guess is potentially a question, but when are we next due to review the audits of the more prevention side of things? Because I think it's been highlighted prevention is often a cure to some of the mental health issues. So I think those elements, I don't know if members are in agreement with what I'm sort of suggesting. Yeah, cool, fantastic. Thank you so much indeed for your attendance in relation to this really important element. I think Mike and Alex will coordinate it hopefully after probably a brief conversation and a lie down possibly. But yeah, and we'll coordinate that. So thank you so much for that report. So item number 7, joint health scrutiny update. Councillor Hutchinson would have possibly had to leave. He gave his apologies that he had to leave at 8 o'clock. So perhaps Mike, you can give us a very brief update on this, please.
Yes, thank you, Chair. Very briefly, 2 things to report on. The members may remember that the West Yorkshire Joint Health Scrutiny Committee was looking at vascular services and was formally consulted on changes to vascular services. That committee has now finished its work. Unfortunately, the last meeting was in quorum, so the loose ends about that will be tied up next week when the Joint Scrutiny Committee meets. But in essence, Councillor Hutchinson and the other members of that group, Councillor Smage from Kirklees was the joint chair with Councillor Hutchinson, did a really detailed bit of scrutiny, and their conclusions at the end were, having received a number of assurances, for example, about staff training and vacancy management, they were content with the proposals and the way forward that the that the service is developing with 2 specialist units across West Yorkshire. So that work is complete. And the Joint Health Scrutiny, the West Yorkshire Joint Health Scrutiny Committee overall committee meets next Tuesday, the 24th of November, and is majoring in on health inequalities at that meeting, and has also asked for each of the councils represented on that committee to report on activity about health inequalities in their own area. Now, I know that a couple of the scrutiny committees in other parts of the county have done detailed items on health inequalities. I think your approach has been to pick up health inequalities in discussions like the one you've just had, where you picked up on a number of important inequalities issues in the discussion. And I will brief Councillor. I'll have a discussion with Councillor Hutchinson and Councillor Baines, who's our other representative on this body. And for anyone who's interested, it's at 10 o'clock on Tuesday morning. And you can watch it on YouTube if anyone's interested.
Indeed, thank you, Mike, for that. And talking about YouTube, actually, we've had a question in from somebody in the public. So thank you for watching and bearing us with us from the member of the public. So I think Councillor Barnes is going to raise a question on that person's behalf before we quickly move on.
Thank you, Chair, for this. I've been contacted by a local resident. We do obviously have avid YouTube watchers. So that's quite interesting. What they've asked, and I think this is probably for Karen, and I think it really relates to what you said earlier on about the feeling that you're getting in this lockdown, is that the question is why are so many retail outlets still open in the second lockdown, in terms of the definition of what is essential retail and what is non-essential retail, I suppose, is where they're coming from. So that's the specific question that the resident has asked.
Okay, thank you for the resident for raising that. So Karen, would you like to briefly come back on that?
Yeah, the regulations that the government brought out that came out in conjunction with the latest lockdown is quite specific on what is regarded as essential and not essential. Obviously, I think by and large people have been sticking to that, but certainly where we've had reports of that not happening, our environmental health officers have been visiting them and making clear whether they should be visiting or not. So, for example, just to give you an example, in the last 7 days, our environmental health officer colleagues have visited 175 premises in a week. So basically, we're working with our environmental health colleagues to make sure that anything that's not essential, that shouldn't be open, won't be.
Excellent. Okay, thank you for that. So swiftly moving on to the work programme. The work programme has been circulated. It's a moving escalator. Mike, would you like to briefly come back in on that?
Thank you, Chair. Just one thing. I was involved in a discussion at the agenda setting meeting for the Health and Wellbeing Board. The issue of dentistry came up, and the Health and Wellbeing Board agenda setting meeting remembered the work that Councillor Greenwood and Councillor Barnes started before all this, back in January and February earlier on, and they asked whether Scrutiny would be prepared to pick up on that work again, both in relation to children's oral health and adults. So that's a request from the Health and Wellbeing Board that, and perhaps with a bit of a focus on COVID and the accessibility of dentistry, which wasn't an issue that we considered in January and February. And so if the board agrees, we can get that little working group established with anybody else who might be interested in joining it, and pick up those issues and report back probably into both this board and to the Children and Young People's Board as well.
Okay, yeah, no, that sounds good. Good to me. I think a way forward. So I think that's it as far as I can see from the work programme and the meeting. So thank you so much for your patience. Thank you for officers for attending and all the extremely useful information that you've provided us with tonight. Has been a really useful update, and I hope you have a very nice, pleasant rest of the evening. So thank you very much for attending, and thank you. Goodbye.
Thank you.
Thank you, everyone. Thank you, Chair.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Okay, everybody?
I'm just waiting to end the stream. Alex, have you had